Welcome back. Antidepressant withdrawal syndrome is not just a return of the original depression. It's a set of totally new symptoms that you did not have before you took the antidepressants and are created by the antidepressant drugs changing or recalibrating your brain. For sure, when you discontinue antidepressants, you could have a return of the original depression, anxiety, or other condition. But for now, you have to deal with the new condition caused by the antidepressants, which is called antidepressant withdrawal syndrome, also known as antidepressant discontinuation syndrome. In this video, you'll learn how to recognize antidepressant withdrawal syndrome. What are the signs and symptoms that indicate you have it? You'll learn what causes it, how antidepressants recalibrate your brain to create this new condition. I'll explain how I treat antidepressant withdrawal syndrome and speed up recovery by deliberately boosting or stimulating neuroplasticity to increase the rate at which your brain grows brand new synapses. These new synapses have never been exposed to antidepressants and are properly normally calibrated. There are a lot of people that take antidepressants, stop them, and recover fairly quickly. If that's not you, if you're having a long drawn out protracted antidepressant withdrawal, maybe even your recovery is stalled, you're not making any progress, then the first goal of treatment would be to boost neuroplasticity, reduce wear and tear on the brain, to speed up and optimize your brain's ability to recover itself. In a way, I would say it's to push you towards being one of those people that recovers quickly. We also want to make the recovery very complete. I mean to say that you make a full recovery, 100%, with no lingering after effects. An additional treatment goal is to go beyond just simply repairing what the antidepressants have done to you, but actually strengthen the underlying weakness in the brain that's causing the withdrawal syndrome and probably caused the original depression or anxiety in the first place. Also in this video, I'll tell you how to do a slow, what is called a hyperbolic taper, if you haven't already stopped taking the antidepressants, and why for some people, even this strategy may not help you avoid withdrawal syndrome. So let's begin. How do you recognize that you have antidepressant withdrawal syndrome? We'll use the mnemonic FINISH. F stands for flu-like or fever. Many people experience hot flushes, sweats, and fever symptoms. These may occur at night when you're sleeping or even in the day, and it feels like you've got the flu. I stands for insomnia. There can be difficulty getting asleep, difficulty staying asleep, waking early, and a very common symptom is disturbed dreams and nightmares. Later in the video, I'll explain the neurobiology of what antidepressants have done to the brain that causes these symptoms. N stands for nausea and stomach discomfort. I stands for imbalance. We can feel wobbly, uneasy, dizzy, like vertigo. S stands for sensory distress. This can include being hypersensitive to lights and sound. It can also include sensations of the brain being zapped, like electrical zaps in the brain, sudden jolts. H stands for hyperarousal or hypervigilance about our surroundings and potential threats. It manifests as feelings of anxiety, agitation, sometimes irritability as well. Our nervous system is hyperaroused. We may feel sensations on the skin, our clothes on our skin. Pain sensations in the body become intensified. So that's the FINISH mnemonic. If you see a collection of these symptoms, and you didn't have these symptoms before you took the antidepressants, or maybe you had some of them, but they were very mild, and now they've become significantly intensified, then this indicates that you now have antidepressant withdrawal syndrome. Something else to mention is one of the most distressing potential side effects of taking antidepressants is sexual dysfunction. This can take the form of everything from a lack of interest, an inability to perform, and a lack of feeling or numbness in the genital area. Actually, sexual dysfunction is not specifically a symptom of antidepressant withdrawal syndrome. It can also occur while you're still taking antidepressants. But unfortunately for some people, this symptom can linger even after they discontinue antidepressants and may require additional treatment. Sexual dysfunction is more likely to occur in men. However, when it occurs in women, it often takes a more serious and debilitating form, either no libido or genital numbness or an inability to get aroused. Fortunately, there are some supplements that have been shown to significantly treat antidepressant sexual-induced dysfunction. These supplements include saffron, maca root, sami, and rosa damascena. I might say more about these in another video. I'm not going to spend a lot of time discussing the percentages of how common antidepressant withdrawal syndrome is, or how bad it is, or criticizing psychiatry. The reason I'm not going to do that is because there are other people and doctors and psychiatrists who make good videos discussing the dangers of psychiatric medicine. My YouTube channel is about understanding the biology of what causes these problems and mental health problems, and then using that knowledge to put together self-help holistic treatments to try to solve and overcome the problems. But briefly, from what I can see in the science literature, there's about 1/3 of people who discontinue antidepressants will experience some degree of withdrawal syndrome. It's a lot. But for most of that 1/3, the symptoms will either be relatively mild, or even if they're severe, they will only last for a short period of time. Perhaps about 1 or 2 or 3% of people that take antidepressants will experience really quite severe withdrawal symptoms. But again, that might be relatively short-lived, lasting from weeks to months. But then there are the remaining individuals, and far too many of you, for whom withdrawal syndromes last a very long time, maybe months, even years. And unfortunately, the mainstream medical view is that this isn't possible. They argue that after the drug is washed out of your body, you cannot still be suffering from withdrawal symptoms many months later. But of course, many of you know that that's just simply not true, that you are not just being depressed or anxious and making up symptoms. You're not being a hypochondriac. You know that after you came off the drug, you developed a new kind of sickness that you didn't have before. Unfortunately, it takes a very long time for new science to filter all the way down or trickle all the way down to frontline doctors and psychiatrists. Today, we have a new understanding of how the brain works. We know that because of a process called neuroplasticity, the brain, specifically the synapses where the neurotransmitters work, can become changed by drugs. So SSRIs, for example, make your synapses less sensitive to serotonin. Your serotonin synapses become recalibrated by SSRIs, down-regulated. And then when you come off the drug, your synapses may not just quickly recalibrate themselves back to how they were before you took it. And we're all different. Some people have very resilient neuroplasticity. Maybe their synapses may not be so strongly desensitized by the SSRIs in the first place. And their ability to recalibrate their synapses is very strong, so they recover quickly. But then there are other, less fortunate people that have weak neuroplasticity, so their ability to repair and regenerate the brain is not strong. And they may also have excess ongoing wear and tear in the brain from other sources, mainly inflammation in the body, that is constantly undermining the repair process. And when you put psychiatric drugs into these brains, they may really struggle to get back to normal. Now, I know it could be distressing when I suggest that if you're suffering from protracted antidepressant withdrawal syndrome, you probably have poor neuroplasticity and a high level of wear and tear on your brain. So let me quickly say something positive. We now know that the brain has a tremendous ability to remodel itself, to repair and regenerate, recalibrate synapses, grow brand new synapses. So if you have a slow healing brain with poor neuroplasticity and high levels of inflammation and oxidative stress undermining your ability to make a speedy recovery from antidepressants, what you can do to speed up the recovery process is boost your neuroplasticity, specifically boost the production of BDNF on the one hand, and on the other hand, eliminate everything from your body and brain that puts increased wear and tear on it. By doing this, we can stimulate the growth of brand new synapses that have never been exposed to antidepressants. And there's a thing called synaptic plasticity, which we can stimulate to encourage the synapses to recover their sensitivity. And this isn't just my idea. The pharmaceutical industry is looking for a new generation of antidepressant drugs that will focus on boosting neuroplasticity and have anti-inflammatory, specifically targeting, if you're interested, certain cytokines, because the consensus is that's the new direction to go in. But some of us in the functional medicine space don't want to wait. So we've already started working out ways of boosting neuroplasticity using natural self-help supplements and therapies. I've been developing treatment programs to boost neuroplasticity and eliminate the things that tax neuroplasticity since 2010. I did this on myself first to improve the loss of cognitive function that I was suffering from, caused by the bipolar disorder I live with. And since then I've adapted the techniques to suit the brains of people recovering from drug withdrawals, including benzos, antidepressants, and recreational drugs like cocaine. If you're interested, in my next video, I'll explain all about how depression is actually caused by inflammation. In a way, you can say depression is an inflammatory condition. If you don't want to miss that video, consider subscribing and clicking the notifications bell. So why do antidepressants cause withdrawal syndrome? Well, the answer might surprise you. It's not the drop in serotonin activity in one region of the brain. It's actually a rebound increased level of norepinephrine activity in another part of the brain. Let me draw you a diagram of what happens. Here we see a diagram of a typical synapse. The nerve cell or neuron at the top is manufacturing neurotransmitters, releasing them into the space between the two neurons. This space is called the synaptic cleft. The neurotransmitter travels across the synaptic cleft, attaches to a receptor site on the receiving neuron, and when it attaches to the receptor site, now, after release into the synaptic cleft, some of the neurotransmitters just get broken down. The antidepressants called MAOIs inhibit the enzymes that break down neurotransmitters. Some of the neurotransmitters are actually transported by what are called transporter proteins back into the original neuron, and they get recycled. In the case of serotonin, the transporter protein is called SERT. And what SSRI antidepressants do is they attach to and inhibit the action of SERT, the transporter protein. They stop serotonin from being reabsorbed. It's in the name, serotonin reuptake inhibitors. The net effect of antidepressants, whether it's SSRIs, tricyclic antidepressants, or the MAOIs, is that the amount of neurotransmitter in the synaptic cleft increases. From the point of view of the receiving neuron, there's actually too much neurotransmitter bombarding its receptor sites. So what it does is it starts desensitizing itself, removing some of the receptor sites. Now, I've only drawn 2 receptor sites in this diagram so you can actually see them, but there's usually several hundred receptor sites across this membrane here. This is called the postsynaptic membrane. At least there would be several hundred when you start taking antidepressants, but after you've taken the antidepressants for a while, the receiving neuron will adapt by stripping out a portion of the receptor sites. When you then stop taking the antidepressant and neurotransmitter levels fall down to normal, you've got too few receptor sites to pick them up, and you end up with underactivity in the receiving neuron. But the drop in serotonin activity does not adequately explain the symptoms of antidepressant withdrawal syndrome. The symptoms don't look like low serotonin. They actually look like excessive norepinephrine. Oh, I should say that in the UK and the US there's a different pronunciation for norepinephrine. So some of you say norepinephrine and some of us say norepinephrine, or the other way around. I forget which is which now. It's the same word, just hear it in your regional dialect. So what do we really think causes antidepressant withdrawal syndrome? Well, it turns out that the biggest concentration of serotonin neurons is in a brain structure called the dorsal Ralph nucleus. And the dorsal Ralph nucleus has lots of connections, strong controlling connections, to a brain structure called the locus coeruleus. And the locus coeruleus is the main site of norepinephrine production. So it looks like when you discontinue antidepressants, you get this drop in serotonin in the DNR, and that results in less controlling, dampening down activity of the locus coeruleus when norepinephrine is made, resulting in an upswing or increased activity in norepinephrine and all the structures connected to the locus coeruleus. This increased level of norepinephrine activity can actually explain all of the antidepressant withdrawal symptoms in the Finnish acronym. Firstly, elevated norepinephrine activates the immune system and create flu-like or feverish hot sweats. Elevated norepinephrine can account for the insomnia and dreaming sleep disturbances. This is because norepinephrine is very stimulating. It's arousing. It wakes us up and makes us vigilant about our surroundings. When we are in danger, we want norepinephrine, adrenaline, and cortisol to wake us up. During the second half of the night, we enter into dreaming sleep, also called REM sleep. And for REM sleep to occur, noradrenergic activity in the locus coeruleus has to be switched off. This is called the noradrenergic timeout. Unfortunately, when you come off antidepressants, get a rebound reduction in the level of serotonin activity in your dorsal Ralph nucleus, which in turn leads to reduced inhibition of the noradrenergic activity in the locus coeruleus. You don't get the noradrenergic timeout, and you cannot achieve good quality restorative dreaming sleep. You may just wake up in the second half of the night when your brain tries to go into REM sleep. Or even if you do get some REM sleep, it's likely to involve anxious and agitated dreams or nightmares. And then this creates an additional problem, which is that a lack of sleep also impedes your ability to repair and regenerate your brain. You see, most neuroplastic regeneration occurs in the brain while we sleep. I mean to say that to have good neuroplastic repair of the brain, you have to have good sleep. There's a very important lesson to draw from this, which is that one of the most important targets for treatment to speed up antidepressant withdrawal recovery is to focus on treating and improving sleep. And that is something that we can do. In my practice, I've developed sleep treatment techniques. There are special combinations of supplements to repair sleep physiology, brain training techniques to restore sleep physiology, and other tricks we can use. Originally, I developed sleep physiology and training techniques to treat my own bipolar disorder. You see, bipolar disorder can result in insomnia, and then protracted insomnia can trigger severe mania or even psychosis. But also the other way around. A lack of sleep for any reason can reactivate the bipolar disorder, particularly triggering mania. Other features of bipolar disorder is that we have poor neuroplasticity and high levels of inflammation with a lot of wear and tear in the brain. So we can suffer from accelerated brain aging, and at one point I did. And we need great quality sleep to protect and repair our brains. It took me a year of study and training or entraining my sleep physiology, but eventually I got to the point where I can get as much sleep as I need every 24 hours. Unfortunately, there's no super quick fix for the difficulty in sleeping. I don't have some magical herbal tea, you drink this and then you're going to sleep like a baby through the night. Although it is worth employing all of the sleep enhancing tricks, you have to set up the right physiology in the body. Get cortisol low, melatonin high, cool the core down, cool the brain down. Lying in bed, you can use breathing techniques, eye movement techniques, there's sleep distraction techniques, and it's all good. But if the fundamental brain chemistry in your brain is out of balance, it's just going to undermine all of that. What I used to face with my bipolar disorder was elevated high glutamate, making my brain so speedy I just couldn't fall asleep at all. What you guys with the antidepressant withdrawal syndrome have to face is the elevated norepinephrine bleeding into your dreaming sleep and wrecking it. So all of those additional techniques will be limited by an imbalance in the chemistry of your brain. So what we need to start with is building up serotonin activity in the DNR to start dampening down norepinephrine activity in the locus coeruleus. That could improve your sleep a little, which means you regenerate the brain a little, then you get more control and sleep even better, and you get into an upward spiral of repair. If you'd like to learn more about how to be a great sleeper, I wrote a book on sleep called Sleep Better with Natural Therapies. But actually that was published back in 2013, and obviously I've updated and added new techniques since then. So if you'd like to get my up-to-date sleep training techniques, I do online consultations, and when sleep is an issue, I will always go through all of those techniques. This is probably a good time to introduce myself. My name is Peter Smith. I've been working as a nutritional functional medicine practitioner since 1988, and I've specialised exclusively in the treatment of mental and brain health conditions since 2010. If it's of any interest to you, I have bipolar disorder myself, and I've used holistic functional medicine techniques successfully to keep my mental health condition in full remission for over 15 years now. If you'd like to get my professional help to put together a treatment program to optimize your chances of a speedy recovery from antidepressant withdrawal, I'll give you the details of how to book an appointment at the end of the video. Okay, back to explaining why the rebound increase in norepinephrine explains all the symptoms of antidepressant withdrawal syndrome. Next is nausea. Nausea is linked to increased norepinephrine activity in the brain. During episodes of nausea, brain scans have shown increased activity in the locus coeruleus, the main site of norepinephrine production, and also increased in structures that are connected to it, including the amygdala. Next is imbalance. Disturbances in norepinephrine are involved in vertigo and balance perception. Anything that disturbs that can give us this vertigo perception of being kind of wobbly in some way. Next are the sensory disturbances. Hyperactivity in the noradrenergic system can create hyper-awareness of sensory input. We may become very sensitive and overwhelmed by bright lights and noise. We may become aware of sensory information that we wouldn't normally notice. For example, we may feel our clothes on our skin or tiny little aches and pains that you wouldn't normally notice in the body. Elevated norepinephrine gives us an increased perception of pain. So if you do have any pain issues in your body, they probably become worse. People sometimes experience tingling sensations, burning sensations, and what are called brain saps, which is the sensation of like an electrical shock or a zap in the brain. These are all signs of heightened activity in the noradrenergic systems of the brain. And finally, hyperarousal or hypervigilance, specifically for the perception of threats and danger. This creates a state of anxiety and agitation, which are really horrible to live with. The reason we may experience anxiety is because neurons from the local coeruleus directly connect to a structure in the brain called the amygdala. Now, the amygdala has many jobs, but it's very much involved in the perception of threat and danger. And when it becomes hyperactive, we experience anxiety. Online, you'll often see people talking about anxiety-based amygdala being due to a lack of GABA in the amygdala. But it can also involve excess levels of norepinephrine that ramp up vigilance, creating a hypervigilant state about potential threats. Another potential consequence of increased norepinephrine activity in the amygdala can be irritability and aggressivity. So let's summarize what we've learned so far. All of the symptoms of antidepressant withdrawal syndrome can best be explained in terms of the rebound increased levels of norepinephrine activity originating from the locus coeruleus, because it is not being adequately dampened down or controlled by the dorsal Ralph nucleus, because the antidepressants have desensitized the synapses in that area to serotonin. It may seem surprising to blame increased norepinephrine levels for causing antidepressant withdrawal syndrome rather than reduced levels of serotonin in the synapses. But neuroscience is complicated and often surprising. Now, I don't want to confuse you, but we actually now don't believe that the way antidepressants work is because they increase serotonin levels in the synapses. That simplistic understanding of a chemical imbalance theory of depression was basically scientifically overturned by the early 2000s. And even though it's outdated, it's still a popular belief today. We now understand the primary antidepressant effect from antidepressants is produced not because they inhibit the transporter proteins, causing more neurotransmitter to build up in the synapses. The up-to-date understanding involves neuroplasticity, inflammation, and receptor site proteins being detached from the receptor sites. If you're interested in updating your understanding of what causes depression beyond the outdated neurotransmitter chemical imbalance theory, see my videos. One is called Why Neurotransmitter Tests Don't Work, and a second video, which should hopefully be out next week, will be called something like Depression Inflammation, or Why Inflammation Causes Depression. Okay, so that's an explanation about what actually causes antidepressant withdrawal syndrome. But the more important questions are, what can we do to speed up your recovery? And if you're still taking antidepressants, what can we do to reduce the chances of you developing antidepressant withdrawal syndrome in the first place? There are two things you can do. The first one is, if you are on an antidepressant with a short half-life, it may make sense to switch over to an antidepressant with a longer half-life. The half-life of a drug is how many hours does it take for the levels in the blood to drop by half or 50% after the last dose you took. Some antidepressants have very short half-lives. Paroxetine, also known as Seroxat, has a half-life of just 21 hours, not even a day. This means that the levels in the blood drop rapidly, exposing you to an aggressive withdrawal effect. Conversely, fluoxetine or Prozac has a very long half-life of 96 to 144 hours or 4 to 6 days. And this produces a much more gradual and gentler withdrawal effect. So if you're on an antidepressant with a short half-life, you could consult with your doctor about transitioning over to an antidepressant with a longer half-life, such as Prozac. The second way you can reduce your chances of developing antidepressant withdrawal is by doing a slow, what is called hyperbolic or exponential taper. The hyperbolic taper system was researched by Dr. Mark Horowitz. You can find many videos of him talking about this. Usually it's a podcast interview, but I have a word of caution about those videos. Many of them include expressions like brain damage or brain injury. And I don't agree with these terms. I don't think it's an accurate description of what antidepressants have actually done to the brain. I think that the words damage and injury are distressing. They're incredibly pessimistic and disempowering. Let me give you a more hopeful and optimistic take on it. Antidepressants do not kill any neurons. They don't even prune the synaptic branches. In fact, they stimulate the growth of synaptic branches. This is one of the main reasons why they have an antidepressant effect. If you want to understand more about that, watch my next video on depression and inflammation. What antidepressants have actually done to your brain that causes withdrawal syndrome is they've just downregulated the sensitivity within the synapses and receptor sites. And this is a totally natural neuroplastic process. And those very same neuroplastic processes can recalibrate and repair the sensitivity in your synapses back to normal functioning. There is no permanent brain damage. Permanent brain damage would be something like drinking a bottle of insecticide. That's going to kill neurons. I've got nothing for that. Can't resurrect the dead. Or a traumatic brain injury or a stroke. Yeah, there you've got proper brain damage. Antidepressant withdrawal syndrome is just a very uncomfortable but reversible neuroplastic recalibration. Let's not forget the majority of people, like 70% of people, give up antidepressants either with no withdrawal syndrome or they recover very quickly. Now, please don't misunderstand me. I'm not in any way, shape or form demeaning the very real suffering that has been inflicted on you by these drugs, and almost definitely without you being informed that they could do this. I totally agree that the lack of transparency about the potential side effects of antidepressants, both when you're on them and when you try to come off them, is disgraceful. I believe there should be much more transparency about these potential risks so that people are able to make informed choices and informed consent. But my channel is not about discussing these issues. My focus as a functional medicine practitioner is entirely on solutions to existing problems. If your brain isn't recovering and you have serious or protracted antidepressant withdrawal, the question is there something in your body creating increased wear and tear on your brain? And also, do you have weak neuroplasticity? And then if so, how can we reduce wear and tear in your brain, promote neuroplasticity, and then speed up your recovery? Before moving on to explain how to do that, let me say a little bit more about a parabolic taper. The system involves making bigger cuts in your dosage in the beginning and then much smaller cuts as the dosage of the drug gets lower. The reason for this that Dr. Mark Horowitz discovered was that the rate or amount that an antidepressant drug attaches to its target proteins does not go down like in a straight line. So let's say that you reduce your starting dosage, your full dosage, by 20% down to 80%. It turns out that this does not produce a 20% decrease in the attachment or engagement of the drug to its target protein. It might only produce a 5% or less reduction in the actual effect of the antidepressant. But then as you go down and down, you start getting bigger changes in the effects of the drug. So let's say you're now down to 30% from your starting dosage, and you cut that by 20%. It will have a much bigger effect than cutting 20% of the original. Unfortunately, this is something that many doctors and psychiatrists disagree with or just don't understand. They say that when you get down to these very small doses, you can just step off. It just discontinue. It doesn't. The doses the size of the dosages you're talking about are so small, they're not really doing anything. But many of you know that that is not the case. When you get down to very low doses, even tiny doses, making microscopic changes that most psychiatrists would say are too small to have any effect, turn out to have very big effects. I have a page on my website about how to do a graduated parabolic, or I actually call it an exponential taper. Actually, from memory, I think that page only describes the tapering for benzos, but the exact same principle applies for antidepressants. Unfortunately, I'm sorry to have to tell you, but there are some people, it's probably a very small number, but some people have a genetic variation so that their brain develops with altered function in specific serotonin receptor sites called 5-HT1A receptors. And this increases the person's vulnerability to stress, anxiety, and depression. It may also explain why some people are more vulnerable to antidepressant withdrawal syndrome. And it could be that people with this genetic variation will still suffer from antidepressant withdrawal syndrome, even if they do the correct exponential or parabolic tapering system. It's still worth doing a parabolic taper because you're more likely to not have that genetic variation. And even if you do, and it's contributed to you developing antidepressant withdrawal syndrome, ultimately you still have the same job to do, which is help your brain recalibrate itself back into balance. And how we do that is the next and final section. The treatment strategy I use to restore balance to a brain that's been recalibrated by any drug, from antidepressants through benzos to cocaine, is to boost neuroplasticity on the one hand and reduce everything that reduces or taxes neuroplasticity on the other, so that the natural healing processes in the brain can do its thing and the person can recover more quickly and thoroughly. So what is neuroplasticity? Sometimes you see online neuroplasticity is described as the ability to learn a new skill, like learning a language or learning to play a new instrument. But we're not talking about that kind of neuroplasticity at all. In this context, neuroplasticity refers to the ability to form new synapses, to replace the synapses that antidepressants have downregulated. And the cool thing is, these new synapses are fully functional. They are brand new, straight out the box, so to speak. They have never been exposed to an antidepressant and had their sensitivity downregulated. Then there's a thing called synaptic plasticity. The synapses themselves have the ability to recover their sensitivity, to grow back missing receptor sites, the receptor sites that they stripped out when they were on the drug. And remember, these are totally normal processes that every brain possesses. This is how most people recover in a reasonably quick and straightforward way after they discontinue antidepressants. So a simplistic, practical way of explaining it is that in those people that do not recover quickly, the people that suffer from a long and protracted withdrawal must have some unhealthy balance between the strength of their neuroplasticity on the one hand and then all of the wear and tear and inflammatory processes on the other hand. And successful treatment involves flipping that situation, boosting neuroplasticity and reducing wear and tear sufficiently that the repair systems prevail. So how do we boost neuroplasticity to speed up recovery? I have specific combinations of supplements with BDNF or neuroplasticity boosting effects, which I've been trying and testing since 2010. BDNF stands for brain-derived neurotrophic factor. It's basically a chemical that stimulates neuroplasticity. BDNF stimulates the growth of new synaptic connections, the repair of existing synapses. Sometimes people describe BDNF as miracle grow, the fertilizer that you put on plants and then they suddenly go through a growth spurt. Now, not all brains are blessed with an abundance of BDNF. In serious depression, in bipolar, in schizophrenia, research has shown that in us with those conditions, we have generally lower levels of BDNF and poorer neuroplasticity. Now, boosting BDNF and neuroplasticity across the whole brain is a good start. However, we want to try to focus the neuroplastic regeneration in the serotonergic systems of the brain, specifically the dorsal Ralph nucleus. And we can influence this by selecting supplements that not only boost BDNF in general, but also have serotonin boosting effects. And also at the same time use additional remedies that may not boost BDNF and neuroplasticity, but just directly boost serotonin production. There's a famous expression in neurobiology: nerves that fire together wire together. In practical terms, what this means is, if we stimulate serotonin activity in neighboring neurons, they will respond in kind by growing new synaptic connections between themselves. And that's what we want, new synapses. Let me explain that again. Boosting neuroplasticity in general stimulates the growth of new synapses everywhere in the brain. But if you then combine it with serotonergic boosting supplements, we can increase synaptic genesis, or the growth of new synapses, specifically in serotonin systems. Even though the symptoms of antidepressant withdrawal syndrome may be coming more from an upsurge in norepinephrine activity, the root cause is the rebound downswing in serotonin activity, particularly in the dorsal Ralph nucleus. So that's what the treatment needs to target. In addition to specific supplements, there are also foods to include in the diet that boost neuroplasticity. Basically, polyphenol-rich foods boost neuroplasticity, and there are definitely lots of foods to exclude totally, primarily bad carbohydrates, because they decrease neuroplasticity. People often ask me to just give them the list of supplements that I use to boost neuroplasticity. The problem with that is, that's only half the job. If you don't do the other half, which is removing wear and tear on the system, it will likely totally undermine the effectiveness of the supplement prescription. The other half of the treatment, which is just as important, or maybe even more important, is to eliminate the things in your body and brain that are taxing and weakening your neuroplasticity. These may be the very reason why you've developed antidepressant withdrawal syndrome in the first place. For example, chronically elevated inflammation prunes away synaptic connections more quickly. In fact, it's now believed that a primary, if not the primary, real cause of depression is chronic inflammation in the brain, pruning away synaptic connections faster than your neuroplasticity can grow them back and replace them. It appears we got it wrong. The simple chemical imbalance theory of depression is wrong. It's not a lack of serotonin or dopamine in the synapses. It's actually too few synapses to carry and hold your serotonin and dopamine, because chronic inflammation has been pruning away the synapses faster than you can grow them back. So chronic elevated inflammation in the brain might be the reason that you got depression and had to take antidepressants in the first place. And now it could be the reason why you're suffering from horrible antidepressant withdrawal syndrome. Do you see the point I was making about the two halves of the treatment? If you were to just take supplements, which many people want to do, that boost neuroplasticity, but leave in place sources of inflammation, the pruning effect of the inflammation will just totally undermine the benefits you get from the supplements. It's a complete waste of time and money. To successfully regenerate a brain, you should focus on eliminating everything you possibly can that can cause inflammation. So where does inflammation come from? Well, that's actually going to be the subject of my next video. But briefly while I'm here, there are some easy things to identify and target, such as eating sugary carbohydrates, smoking, being deficient in magnesium, vitamin D, omega-3 oils. All these things cause inflammation and they're quite easy to get rid of. Believe it or not, pure nicotine actually boosts neuroplasticity and BDNF. You have to quit smoking, but you can keep the nicotine if you deliver it in a pure pharmaceutical grade. Another very significant source of inflammation is overactivation of the body's fight or flight responses. When our nervous and hormonal systems goes into fight or flight mode, it activates the immune system, which then releases these chemicals called cytokines, which switch on inflammation in the brain. Unfortunately, one of the symptoms of antidepressant withdrawal syndrome can be anxiety, which then seriously activates our stress responses. And this not only drives up inflammation, but it also stimulates the release of even more norepinephrine. This is a catch-22 situation. Increased norepinephrine can produce anxiety, which produces stress responses that then produces more norepinephrine. And we need to interrupt this self-perpetuating vicious circle. In my practice, I've successfully used deep relaxation brain training exercises. You have to do a lot of hours. At the end of the video, I'll tell you how you could get a free MP3 recording and instructions to guide you through how to do that. If you find that or any of the information in this video valuable, I'd really appreciate you giving me a thumbs up. When I get a like, it tells me what type of content you'd like to see more of. And it also helps to promote this information to a wider audience of other people that might benefit from it. Moving on. Infections anywhere in the body are very significant sources of inflammation. If you are prone to having chronic infections in your sinuses, your gums, your throat, your chest, your small intestines, bacterial overgrowth, small intestine bacterial overgrowth, the overgrowth of unfriendly bacteria in your large intestines, kidney, urinary tract infections, and then serious things like Lyme or Borrelia are huge sources of inflammation and have to be eliminated. A leaky gut that allows bacteria, whether friendly or unfriendly, to leak through the intestinal wall and enter the bloodstream. Another serious source of inflammation that has to be eliminated. You can try putting together your own treatment plan, or if you did decide to get my professional help, one of the things that I do in a consultation is go through your current situation and case history, and I'm looking for any of those sources of inflammation and then target them. Remember, these things could be the kind of obstacle in the road preventing your recovery. Another source of inflammation is having a high BMI, being overweight. Particularly abdominal visceral fat is a significant source of inflammation. Believe it or not, this can easily be targeted. I have some specific diets and techniques to target visceral fat. It does take several weeks to eat through it, but it's definitely achievable. A lack of sleep can be another source of inflammation, and as I said, I've got specific training programs for that. Traumatic brain injuries can cause very long-lasting inflammation in the brain. They can activate en masse microglial cells, the brain's immune system cells. And once they've been activated, they may not de-escalate or deactivate themselves. We can use intermittent fasting techniques to increase the turnover rate of microglial cells, basically kill them off and have them replaced by dormant ones. An enhanced fasting technique that I use is to combine supplements that enhance the cleaning autophagy enzymes on the same day that you're doing the fasting to sort of get a more intense fasting effect. Other noteworthy sources of inflammation that need to be eliminated is exposure to mold, food allergies and sensitivities, autoimmune conditions, and there are other things. Besides inflammation, other significant sources of wear and tear on the brain include mitochondrial dysfunction, oxidative stress, and heavy metal toxicity. Incidentally, I think the best way to get rid of dysfunctional mitochondria is intermittent fasting, especially if you boost it with some supplements. So the first step to speeding up recovery from antidepressant withdrawal syndrome is to eliminate all of these things. Then after that, or at the same time, start increasing the production of BDNF and neuroplasticity. When you get all the conditions just right in the brain, low wear and tear, high neuroplasticity, the brain can grow back synapses within just weeks. But realistically, what might slow you down is how long it takes to get rid of all of those things I just mentioned, the inflammatory things, the oxidative stress, etc. So for example, you might spend 4 to 6 weeks eating through visceral fat before it makes a significant difference, or eliminating small intestine bacterial overgrowth, or interrupting that vicious cycle of anxiety causing overactivation of the stress responses, causing more epinephrine and cortisol and inflammation. I'm so sorry if you're suffering right now, but try to find some comfort in the following. Firstly, remember that antidepressants have not killed any of your neurons. They have not caused any permanent brain damage or injury. All they've done is provoke your neuroplasticity to change the calibration of serotonin in your synapses. Secondly, we know most people do recover. We know that the brain is incredibly repairable. When you create the right conditions, your brain will just start sprouting new synaptic connections. I believe that if you optimize the conditions in the brain, it gives you the best chance of making a speedy recovery. In a way, you're trying to change your slow healing brain into the same sort of state as other people's brains that heal from antidepressants, quickly. So there you have it. I hope you found the information in this video helpful and also optimistic. I hope that you learned some things that you can start working on with yourself for your own recovery. You can find more information, free information on my website, balancingbrainchemistry.co.uk. And if you want to take it further and get my professional help to put together an individual treatment program, I do one-to-one consultations online. If you'd like to book an appointment, just put calendly.com/PeterSmithUK into your web browser, pick a time, go through the payment process, and I look forward to seeing some of you there. There will be more self-help tips on how to reduce inflammation in my next video. And finally, if you want to get the free instructions and an MP3 recording on how to do a deep relaxation brain training, just email me and I'll send it to you. You can find my email address in the video description. I know you're hurting right now, but stay strong. You can get through this. Bye for now.